Okay.
So other people in the government haven't wanted to answer this question, but given what's been happening in the hotspots, New York, wherever, Italy, whatever, there are estimates that people are basing orders on. There are scientific models, whether or not you trust them. What have you been told Maine should expect to see?
Well, I haven't had any particular numbers outlined. I had a long call yesterday with Dr. Shaw, the head of our CDC, who, by the way, is emerging from this as a real star. I mean, he's so smart and able and just the right person in this job. I think Maine right now is doing a good job because the governor has been aggressive about social distancing and pushing some pretty tough measures to keep us apart. If we're able to do that, we certainly won't be unscathed. We've already had deaths, and the number of cases are continuing to go up. But I think if we can stick to what the governor has proposed and ordered, I think we're going to come out of this a lot better than a lot of other places. Now, here's one of the interesting things about Maine. There are a lot of people coming to Maine right now from those hotspots. People from New York and Boston who have summer homes who are opening them up in order to get out of the hotspots. I just hope when they do so, they'll isolate themselves for 14 days, which is what I'm doing, having come up here from Washington. So if they do their part and the rest of us do what we're called upon to do, I can't give you a number at all, Beth, but I think it's going to be a lot less than it is in other places.
Okay. And do you think, I mean, given, I've heard numbers. I've heard numbers of Dr. Shaw this morning. I don't know if you watched his briefing, but he gave us numbers for how many ventilators we have, how many are available, how many ICU beds we have, how many are available, how much personal protective equipment we have, how much we don't have. Are you confident that we're as prepared as we can be for what's coming?
No, I'm not. In part because of what I consider a failure from the federal government to, number one, anticipate this problem, and number two, to get the equipment out to the places where it's needed. Had a long call yesterday. I'm spending most of my time on conference calls and Zoom calls. Yesterday also talked to people at Maine Health about what they're doing and how they're getting ready to do this, as well as a call last night with the Defense Department, with the Pentagon, about what their resources are and what they're able to provide. So everybody's still scrambling. And as you know, a lot of Maine businesses have now geared up to make protective equipment. LL Bean stepped up 2 weeks ago, and a number of other of our sort of apparel people are helping out. So we're doing our own work in the state, and as well as working with Washington. Here's what's really bothering me, though. There are indications that some of the allocation of these things, and I say indications, this is a worry, not a straight up accusation, but that there's some politics in this, in the way things are being distributed. And the president has said, well, I don't like that governor because they said something nasty about me, and we'll see if I return their phone call. That's very worrisome. I think we have an obligation to be sure that that's not the case. If there was ever a time that politics shouldn't play a role, this is it.
If politics did play a role in what the reports are, us getting 5% of our request, and if today the Washington Post reported that the national stockpile is almost empty, we missed our chance. I mean, is there any recourse? I mean, if it's all been distributed already, if it's been allocated to the states now, what can we do?
Well, the recourse is, number one, to make it ourselves, which we're already doing. Number two, to tap into private companies around the country that are scrambling to make these products. Number three is to look for resources overseas. As you may have heard, there's a plane landing at Logan Airport today, and in fact, it's the uh, New England Patriots charter
Yes.
plane that's coming from China with 1 million masks on board. That somehow Governor Baker found a supply of masks. LL Bean, I know, is also working on suppliers that they have in Asia to bring in equipment. So we can't simply rely on the national stockpile, which apparently was understocked, if you will. We've got to be doing the thing that Maine people do, which is invent and create and figure out how to work these things out. And of course, the best result would be to go back to the beginning. If we follow the guidelines, we won't need as much. I mean, we'll be able to so-called flatten the curve and lower the demand for these services over a longer period of time, which will enable us to get more equipment.
Last question. Bloomberg reported today that around the country, doctors and nurses that are speaking out about the lack of equipment in the healthcare environments are being fired for that. I've heard anecdotally that that's happening right here. What can we do? I mean, what do you do about that? You know?
Well,
And I'm sort of asking you that just as me asking you, you know? I just
yeah. Well, that shouldn't be happening. I mean, that just shouldn't be happening. I haven't heard of that happening in Maine. I'd be surprised if that was happening in Maine. Everybody's talking about the shortage of equipment, including line nurses and doctors, and right up to the CEO of the hospital. So I don't think that's a surprise to anybody, and it certainly shouldn't be cause for any kind of retribution. This is, this is all hands on deck, and the more information we have, the better off we'll be. Whether it's in terms of number of cases, availability of testing equipment, the number of beds available in our hospitals, all of that is important. And that's why I think Dr. Shaw and Governor Mills have really done a good job of being calm but forthright and factual. And that's what we need to do. So the idea that somebody would get fired for saying they're hurting for material, that's wrong. I can't imagine that would happen here in the state of Maine. I certainly hope not.
Oh God, it just horrifies me.
Yeah.
But anyway, all right. That's only, I mean, you've answered everything. I appreciate that. Do you want to, I mean, you've already said it, but I've heard you say in the past better than anybody else, if somebody's if there's a place that's gonna pull themselves through something, it's probably gonna be Maine. You want the opportunity to say something like that? I mean, not to put words in your mouth.
Well, if I had to pick a place in the country to be right now, it would be the state of Maine. Number one, because we have strong leadership in Augusta. Number two, because we have a tradition of taking care of one another and looking out for one another. Number three, we have a tradition of being civically responsible. And all you got to do is walk out or not walk out, but look out your window and see people are in fact staying in their houses, staying off the streets. And plus, in a few days anyway, hopefully we're going to see some blue skies, and we'll be able to see the beautiful state of Maine either virtually or personally looking out our window or taking a walk. Mary and I take a walk every day here in Brunswick. Now, it's a sort of odd kind of walk because we're on opposite sides of the street.
Right.
But that's what we're doing. And it gives us a chance to get some fresh air and to sort of reflect on what's important, which is family, friends, and this wonderful place that we're blessed to live in.
Thank you so much.